So this week I'm getting my dental cavitations removed and I'm going through a process of preparation. So I wanted to share that with you today. So welcome back to the Energy MD podcast, where we help you resolve your chronic fatigue syndrome and long COVID naturally so that you can get back to living your best life. My name is Evan Hirsch. And so part of my journey, I had chronic fatigue syndrome for about 5 years, from 2010 to 2015, just about destroyed my life, my relationships, my work. And I got over it by addressing the toxic five, what I call the toxic five, which is a combination of heavy metals, chemicals, molds, infections, and nervous system dysfunction or trauma that built up in my body over the course of the span of my lifetime, which at that point I was 30 years old. So part of part of my journey has been that, at that point I got 8 out of 10 energy. I wasn't crashing anymore once I had gone through this process. But a couple years ago, about a year and a half ago, I started having sleep problems. And I haven't been able to figure out why that's been the case. So I've gone back to the drawing board and started to look at my own journey and seeing, what am I missing? What do I need to go back and look at again? Because my knowledge over the last decade has increased significantly. And one of the things that I'm looking at is dental cavitations. So if you're not familiar with this concept, whenever you have any sort of damage to the jaw in the form of either a root canal or a tooth extraction, generally like a wisdom tooth removal, those can cause gaps in the jaw, and consequently you can get fatty necrosis and a hidden dental infection where you may not have any pain, you may not have any discomfort, you may not have any swelling, but you can still have this chronic infection that ends up leaking that infection and inflammation into your body, causing the immune system to react, causing your detox pathways to get clogged, etc. So if you've heard me speak before, you've heard me talk about how there are two tests that are essential for people to get. One is an EMA test to assess whether or not an individual is living in mold. So we have to make sure people aren't living in mold because it's very hard to get them better when they are. And the second test is a cone beam CT test to determine whether or not they have hidden dental cavitations. Now, you get this test at a biologic dentist's office, though not all biologic dentists do this work. So it's very important that when you call and you ask, and we have a list that we provide to our clients of people that we know are doing this work, but you want to make sure that they can not only order the test, but that they can read the test, because that's an important part of this process. And if they do muscle testing, that's even better. So I recently found a dentist not too far from my home. I didn't know she existed previously, but somebody who does do dental cavitation removal. And I went and I met with her, spoke with her on the phone a couple times, and really just trying to get a sense of whether or not she's a good fit for me. And I've been very pleased with what I've seen. And yesterday I went for a peri-oral disinfection, and I'm going to talk a little bit about that in preparation for my dental cavitation surgery later this week. So let's start off with the assessment. So she asked me questions when I went in to meet with her. We did the cone beam CT. Then she also did some muscle testing to determine whether or not it was related to my sleep issues that I was struggling with, and determined that yes, these dental cavitations from the wisdom teeth that I had removed 25 years ago, and granted, I have no pain or dysfunction, but 25 years ago, I had my wisdom teeth removed, and these dental cavitations that showed up on the cone beam CT as well as positive for muscle testing, she believes is going to, by removing them, is going to significantly improve my sleep. So we'll see if that's the case. She did show me the cone beam CT where I was able to see an area in the gum and in the jaw where it was essentially cobblestoned, a cobblestone sort of appearance, indicating that there wasn't smooth bone in that particular area. And she showed me pictures of typically what cavitations look like. And they're black or they're brown. It's fatty necrosis, where basically there's cells that are dying. There's fat that kind of filled in that space, and the cells are dying, and oftentimes they're getting infected, and that's leaching into the rest of the body. So that was the assessment. And then my preparation in this perioral disinfection was basically a very intense cleaning, where she went through a process of probably 10 different items that she applied to my teeth and to break up the biofilm and to get rid of a number of infections that are present in my mouth. I forgot to mention that during the assessment also, she took a slide. So she did a swab of my mouth and she put it onto a slide and then she put it under a very powerful microscope on a TV screen so that I could see what we were looking at. And I could see a number of the infections that were present as well as spirochetes, which are Lyme type infections, otherwise known as Borrelia. And so that indicated to her that I had gone through treatment, which I had, but there were resistant infections in my mouth. It's important to remember that there's a lot of research on how the mouth goes, so goes the rest of the body. So, the mouth is contiguous with the gut and all the way through, and it is our connection to the outer world, essentially. And so it's very important to remember that as the gut goes, so goes the mouth and vice versa. So it's very important not just to be focused on the gut. This is another reason why you may be focused on the gut and not having success, is because you're not focused enough on the mouth and what you need to do there. So we started off, she added on some propolis in order to start breaking up Pseudomonas gingivalis, which is a bacteria that is also been implicated in Alzheimer's. And essentially, every Alzheimer's patient in a particular study was found to have this particular kind of bacteria. And so there was a propolis film that she applied, let it sit for 5 or 10 minutes, then rinsed it off, and then went to apply the next thing, which I believe was um, a combination of activated charcoal and bicarb, which was applied and then put through all the different gaps in my teeth in between every tooth. And then that was left to sit for a period of time. And then there was some air abrasion, which was basically some intense air to try to break up the biofilm. There was a rinse that I did with an antibacterial known as biocidin. There was anti-parasitic herbs that were put on, that were left to sit. And one of the warnings they gave me was that this was not going to taste good. And that they gave that at the beginning, and that was definitely the reality of the situation. They also put on some DMSO, which is an amazing antimicrobial and anti-inflammatory when used properly. And each one of these sat for a period of time and then were rinsed. There was also ozone that was utilized. And so all of these things are killing the infections that are in my mouth that are also disrupting the biofilm. And then she gave me a number of these things to be doing at home in between and now for the next 8 weeks. And at the end of the 8 weeks, I'm going to go back in and we're going to do a slide again to look at what is happening in my mouth. Are there any infections left? And so part of this mouth ritual that I'm going to be doing twice a day includes things like activated charcoal that ends up being rubbed on my teeth and sitting for a period of time, and then also applying an antiparasitic and letting it sit there, not rinsing my mouth before bed, and then also utilizing an MSM, or basically a high sulfur component, as well as an applicator. So a number of different things that need to be done in order to basically kind of sterilize the mouth in this particular way. And part of this is the idea that yes, we want to improve the health of the mouth for improving the health of the body, but part of it is also in preparation for the surgery. So there are going to be antibiotics. I'm going to get IV during the surgery, in addition to IV vitamin C and a number of other things that are natural. This dentist is also a natural doctor. And so all of those things are going to be supportive, but in terms of updating the flora that's in the mouth, I, she wants to kind of sterilize that in preparation for the surgery so that there's less of a chance of me getting any infection in my mouth during the procedure. Because anytime they're going to be drilling into my bone, they're going to be opening up the gum. Anytime you're kind of opening up any sort of wound, you want to make sure that the bacteria, if there's any bacteria that's getting in there, that it's going to be cleaned out and that you're trying to keep the area as healthy as possible. So this is really in preparation for that. Um, and so that's been a very interesting process, and I look forward to seeing how it goes with the surgery that I have later this week. Um, Part of the importance of this process is that, if you've gone through the toxic five, and generally, when I get on free calls with people to see whether or not I can help them, that's the first thing that I'm looking at is what is missing, what hasn't been addressed yet. Are you living in mold? Do you have heavy metals, chemicals, molds, infections, nervous system dysfunction in your body? Have all of those different components been addressed? Have you been assessed for dental cavitations? So I know that success comes from being thorough and dotting our I's and crossing our T's and doing a complete assessment for all of the potential causes. So when we're looking at all the different causes of chronic fatigue syndrome and long COVID, there is always a straw that breaks the camel's back. Absolutely. With long COVID, it's like you got COVID, you've got spike protein illness, and you had persistent symptoms from that. From chronic fatigue syndrome, it could be you got some sort of virus, you got um, Epstein-Barr virus, you were exposed to mold, something like that. You had your mercury fillings removed out of your mouth incorrectly, and then you got chronic fatigue syndrome. So there's always some sort of straw that breaks the camel's back, but it is this bigger picture of the stage had to be set for that straw to end up causing your illness. So we're looking at over 30 different causes because everybody that we see who has chronic fatigue syndrome has a combination of about 20 of those. And half of those are deficiencies for the most part, and half of those are toxicities. So the deficiencies are things that you've probably been working on a lot with your local provider. Things like hormone deficiencies, vitamins, minerals, mitochondrial dysfunction, lifestyle habits. So not enough good water, not enough good movement, not enough good food, not enough good sleep, mindset deficiencies. So those are all the deficiencies. And then the toxicities are the toxic five, like I mentioned, the heavy metals, chemicals, molds, infections, nervous system dysfunction, and then structural issues, as well as electromagnetic frequencies, electromagnetic radiation that you might have been exposed to or are being exposed to. So there's over 30 different causes that we're looking at, so it's very important to make sure that we're assessing for all of those. So all of that to say that you want to make sure that you're not missing anything. Because if you are, it's very possible if that is a linchpin or if that is a major cause for you, that you're not going to be able to get to the finish line. So this is my note, whether you're working with us or working with somebody else, it's incredibly important to make sure that they have a very broad differential, that they are assessing for 30 different potential causes, and that all of those different causes are being assessed. Okay? And you can't out supplement your way around nervous system dysfunction and these hidden cavitations and living in mold. So all that to say, you can replace the deficiencies till the cows come home. And we do that as part of our program, but only for a month do we spend time getting to your optimal dose, and then we move on. We do continue you taking those products, but most of the people that we see have spent a lot of time, energy, and money addressing the deficiencies that they have in their body, which naturopaths, functional medicine doctors, integrative doctors, they're all very good at doing this. But it's just the toxic five that generally they just don't have enough experience with. Sometimes they'll dip a toe into one of those, whether it's heavy metals or chemicals or molds or infections, including Lyme and Epstein-Barr and COVID. And the nervous system dysfunction, but generally they're not addressing all of those, which means something's going to be missing. So your job, your mission, should you choose to accept it, is to find out all of your causes and then systematically go through a process like ours to remove all of them. Okay. So that is what I have found to be the recipe for success. So, and the hidden cavitations, the dental cavitations, these dental infections are a very important part of this process because they are so hidden and and so and so much of a problem that they're often missed, unfortunately, because not enough people are talking about them. So hopefully this has brought some awareness to dental cavitations for you, and hopefully you will find a biologic dentist near you to get assessed with a cone beam CT. And one of the couple sites that you can look at, you can Google, biologic dentist near me, or you can go to IAOMT.org, the International Association for Oral and Maxillary Toxicology. IAOMT.org is a good one. And I think that there's another organization for biologic dentists, but I don't remember the acronym at this time. But those can be very helpful for defining somebody. And then you want to call them up and you want to ask them if they recommend, if they have a cone beam CT in their office. That's very important. If they're comfortable reading those, if they have a fragrance-free office, if they've got a mercury-free office. Those are all important things to look for in a biologic dentist. So if this has been helpful for you, please give it a thumbs up and subscribe to the channel. Your support means everything, and it's so helpful for getting this information out to more people who are really struggling with chronic fatigue syndrome and long COVID. And if you are interested in seeing if we're a good fit to work together, you can click on the link below to go check out our latest masterclass, where I go into deep detail on the 4-step process that we use, the Toxic 5, and there's a button underneath that video that you can click on, and you can make application to get on a free 45 to 60-minute call with me, where I'm going to go through a process of determining what's missing to see if I can help you and whether or not I believe that we're a good fit to work together. And if that's the case, and if you believe we're a good fit to work together as well, we can talk about what next steps would look like as well. So thanks so much for joining me. I'll see you in the next episode. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.